Hi guys, my name is Dr. Rahul Khare. I am the owner of Innovative Express Care as well as an emergency physician. Um, and I wanted to talk to you a little bit about COVID-19, what we're seeing on the front lines. I know you guys have been doing the isolation thing for a long time, so hang in there. Um, and let's talk. So we have tested over 1,700 patients at Innovative Express Care. We have had about 260 patients that have tested positive. Good news about those patients are that they're doing relatively well. Um, we follow up with every one of those patients, and what we found out is none of them have died, so 0 deaths. This is really important, as well as about 10 of them were hospitalized. Was on a ventilator, but has actually is now out of the ICU, out of the hospital, and doing much better. So yes, we are seeing a significant amount of positive patients, but the good news is we have not seen any death. Now, please don't take that to think, oh my gosh, like this isn't deadly. You have to realize our patient population. You have to understand research to know that all of my patients, almost all of them, come from this area. Which is high prevalence of healthcare. A lot of them have no other significant health issues. My patient population is very young and well insured. So just know that this is not the population of Chicago nor the United States. It's just the population where we are. So know that the no deaths is important, but it sure cannot be generalized. Everyone starting to ask me, are we peaking? The answer is we are peaking. There's no question about that. The amount of patients that we're seeing, the amount of positives that we're having are starting to level off. We haven't hit the peak yet. We're still increasing, but the exponential growth of it has kind of leveled off to an area of where we are kind of still going up, but not at the trajectory that we were. And we will, my hope is, start to go down in the number of cases as well as the number of tests needed. So let's see what happens there. So this is still far from over, and what I really want people to understand is that if this is a bell-shaped curve of the amount of patients that are positive, we still have the last 3 weeks, 4 weeks to replicate. And those were still a significant amount of people. So even though we have around 250, 260 positive, we have the other 250, 260. So if we are truly peaking right now, we would be around 520 patients in about 3 to 4 weeks. So just know that we have a long way to go, and we just have to be patient. This brings me back to the next point, which is antibody testing. Huge amount of questions on this, and it's something I want to address. The next test that we really need is antibody testing. This is IgM, we call it serology testing. And this is extremely important because this test will tell us if you have been exposed to COVID-19 and have the antibodies have been built in your body, meaning that you have already gotten the virus. And this is important because soon we will have those who are susceptible, meaning they don't have antibodies, or those who are not susceptible, meaning they've already had it or have had the antibodies for some reason and will not mount another cascade of runny nose, cough, fever, all those symptoms. They will not get those things if they come in contact with the virus again. So this is important because right now we don't know how many people have actually gotten COVID-19. We just can't tell. You can say how many people we've tested that are positive, but we cannot really tell what the prevalence rate is. The best guess estimates are in between 20 and 40%. But we don't really know. And when we isolated ourselves and did a shelter in place, we did a really good job, which is great. But a lot of people did not get the virus then and are still susceptible. And this is a good thing However, when we start to peak or when we're down to very few positives, the question is, what do we do? And I can talk a little bit about that. But first, I want to bring up something called herd immunity. A lot of people know about this, a lot of people heard about it, but basically what it means is that the herd, the people all around us, if we can get to between 70 and 90% of the patients that are not susceptible anymore, meaning that they have the antibodies, meaning they've had the virus, that if we have 80% of patients have that, then we therefore do not need to protect ourselves as much or at all. It's called herd immunity. And ultimately, we're striving for this. The best and safest way to get herd immunity for viruses are actually to get a vaccination for it. Obviously, a vaccination, we think we're about a year away, if not a little bit longer. So just know that herd immunity can happen if we get out of shelter in place, but the question is at what cost to human lives and morbidity and mortality. And those are the things that are being debated. There's a lot of issues here that is not just healthcare related. So I think it is so important to understand everyone's fear of why the shelter in place has to happen and has to continue to happen at least until the end of April and maybe longer. Now, I want to talk about why. The number one reason in most of in the public health world's view is that we did not have enough ventilators for patients if we peaked at the numbers that we were seeing when Italy was happening. And so what we were really afraid of is that we would run out of ventilators and we'd have to choose who we were going to put on a ventilator or not. Now, because of the data that we're getting back and because of policies that have been implemented and a variety of other things, the shelter in place, we have decreased the need for a significant amount of ventilators so far. Again, we haven't peaked and we have to continue on the road we're on. But the real question is, on May 1st, on April 30th, do we extend this for 2 weeks? Do we go for another month? Do we say, hey, everyone can go back? And then how do we do that safely? So I think there are three scenarios. One is that we do go back. The second is that we extend the shelter in place for 2 more weeks or longer. I think those are the main two. Let's talk about that. If we do go back in 2 weeks after April 30th, the real question becomes, do you have the antibodies or not? So this serologic testing that we just talked about will be extremely important. Right now, we do not have serologic testing. It's a big problem. I am trying so hard to get it. I've had 5 orders placed and canceled on me, thousands of dollars, tens of thousands of dollars to pay for these refunded because of a variety of things. One is the NMPA, which is the National Medical Products Administration. It is the equivalent to the FDA in China. Delayed some of them over there for good reason because there were some faulty and fake, believe it or not, tests being sent there. So they wanted to approve the ones that they felt were legitimate. The FDA has to approve that, but give it an emergency usage authority, as well as we have labs must be either CLIA waived, CLIA moderate, or CLIA complex. And some of these are being given to the United States, but they're under the CLIA complex certification, which means that I can't do them. Urgent cares can't do them. Only hospitals can. And this is for literally putting a drop of blood into a small plastic container and putting 2 drops of reagent on it. I'm not sure why it would have to be complex, but these are the issues that we're going through. So far we don't have it, and I hope to get them in the next week or so, and we'll definitely tell you when we get them. I'm getting a lot of questions from my colleagues in healthcare, as well as my patients, family and friends. As soon as we get them, we will test them. We'll probably go to the healthcare workers first and then to the general population. But my hope is in the next 1 to 2 weeks, everyone will start to see these. These are important because then we will be able to tell exactly what the percentage of patients who have the antibodies, and therefore we will understand, are we close to getting herd immunity with 70–80% of patients having it, or are we not? And so the last question comes to, are you low risk or are you high risk? Because say they do release us on May 1st. If you are low risk, it's really interesting. Like I said, I have 260 patients without any significant, no deaths, no huge amount of comorbidities, not prolonged hospital stays. They relatively got it and then went back and felt better. So, the question is, if you are low risk, on May 1st and they end the shelter at home, shelter in place, can you go out and be careful, maybe not go in huge places with huge crowds, or maybe there'll be some limitations on it, but it could be where the low risk population responsibly can go out, and the high risk population has to shelter in place, because they are still susceptible to worsening lung disease, ventilators, and possibly death, because they have chronic conditions, or they're elderly, or whatever their high-risk disease process is. So I think it's really important that we understand that the serological testing, and doing it to as many people as we can, getting that evidence, then letting people either go back, or making a decision of, hey, we don't have herd immunity. We still need to bend this curve. Maybe we need to extend it for 2 more weeks. Maybe we need to extend it for four more weeks. So I'm going to let the health departments and the CDC make some of those decisions. But these are the kind of data that they're going to be looking at, and we just don't know enough right now to really to make a generalized, this is what we need to do, because this is a kind of a once in a lifetime. This is definitely a once in a lifetime disease or virus that we're seeing, and it is very important, because there are hundreds of thousands of lives at risk, and I think it's very important to understand that that's what we're playing with. Yes, the economy is very important, and if we don't attend to it, there are going to be a certain amount of deaths just due to the economy. However, if we go back too early, we are going to unfortunately have a lot of deaths of patients that are high risk or elderly, and so we have to understand that there's a fine line, and it's not easy. It's easy to read an article that is convincing one way or the other, but the truth is, I don't know, and I'm one of the so-called experts in this, and I think we have to get more data, and that means, yes, we have to continue the shelter in place, and we have to reassess in a week to see what we're going to do. So that's all I got for you here. There were some questions, and I'd be happy to answer them. I'm going to take the first 4 that we have. And one of the first ones are, do you think that if a patient's giving hydroxychloroquine and a Z-Pak, or with the remdesivir, which is a HIV medication and antiviral, early, when you first begin to show symptoms, you'll have better outcomes. I first think, I'm looking at the hydroxychloroquine data that's coming out now. I don't think it actually helps. We're seeing very interesting data on it, very controversial. So I'm not sure it 100% helps. So it is still in the research phase. I would not, and I was quoted today in the Tribune saying this, I would not give it to my family members if they got COVID-19. And I'm very serious about that. I would have a good discussion with the infectious disease physician. If the patient was hospitalized, if my family member was hospitalized in the intensive care unit, yeah, the risks are very low there. They're 50-50 if they're going to make it or not. I would give it if they agreed to give it, but I would not give it early and prophylactically, because I know that medication has side effects, including cardiac side effects, that have killed people, and many people that use it even without COVID-19. So it is not a very in the dosages and how it's given, you have to be very careful. So I would hold off on that. Another question I have coming from Mary was, I'm afraid to eat takeout food if the person is sick. Could they pass it on? I understand that, but if you can cook and you can do that for a month long, that's better for you. But you have to take a break sometimes. It is stressful to cook every day for you and your family. So honestly, I think it is very safe. Even if the person was sick, they're not going to give it to you through the food. But on the packaging and things like that, if the deliverer has it, that is an area that can be grabbed by you and taken. So there's nothing wrong with a quick wipe down. Many people do it. I don't think that's overly cautious whatsoever, given this time. And if you are at high risk, then it is important to take every precaution that you can, which means staying at home right now. It means wearing masks when you go to the grocery store or picking up things where you're less than 6 feet away from people. Those are the important things you can do right now. Wiping down your groceries when they're delivered, not a bad idea. And I would never be against that. And then the last question is that if you do get COVID-19 and you fully recover, can you get it again or have a relapse? And the answer to that, and this is a medicine, so it's not 100%, but 99% true, is that you will not get it again. It's like mono or like chickenpox. Does it happen? Yes, it does. And those are rare cases, but the truth is, once you get it, you are not susceptible for the most part of it. You are immune. But here's the interesting thing that we're seeing. We used to think that you are immune if you've had it and you don't have the symptoms, you don't have fevers for 3 days, and it's been at least 7 days since you got the symptoms. The truth is, we're seeing positives 10, even 12 days after having all the symptoms gone. So just know that if you have it, you're really not clear until at least 14 days. That's my interpretation. CDC says it's less than that, but we're seeing retests now, and here's a great example. My son had COVID-19. He got it from his very close friend, whose stepmom gave it to him. So he got it. He fully recovered within 5 days. Children don't have significant symptoms compared to adults, so just know that he was, and about 7 to 8 days later, he was totally fine. And the question became, well, can he go see grandma and grandpa? And the answer I thought was, well, he's not susceptible. He's he had it before, and he won't give it to them. So I think he's safe. But just make sure if you get it, you still need to quarantine yourself for a good 14 days from when the symptoms started, and know that you may be susceptible to give it to other people for at least 2 weeks. So that's one thing to really, really be cognizant of, because the last thing you want to do is give someone who is high risk this virus, because it could kill them, and it's really important to know. So I will end it there. You guys, thank you for all the support you're giving Innovative. If there's any testing that you want, make an appointment online. It's just go on our website and you can click on the next appointment time, and we will see you then and get you tested. Again, this is Dr. Khare. It's good to talk with you. You guys take care.